Hi, everyone. So how do we protect the heart while we treat the cancer? So that's the question driving the Global Cardio-Oncology Summit each year. And over the next few weeks, I'm catching up with some of the speakers heading to the VCU this October to give you a sneak peek. I'm Abdelrahmen Ali, a second-year cardiology fellow at UTMB in Galveston. I'm honored to be joined today by Dr. Ana Barac. There are not many people who can claim to have founded a National Cardio-Oncology Council, led two major programs, and helped shape the guidelines the rest of us follow. But Dr. Ana Barac has done all three. She is the Daniela Chair of Cardio-Oncology at Inova Cancer and Heart and Vascular Institute, and she's the Medical Director of Cardio-Oncology Program. She was the founding chair of the ACC Cardio-Oncology Council, co-directs the ACC Annual Cardio-Oncology course, and serves as the Senior Advisor for JACC Cardio-Oncology. Their clinical and research work centers on advanced cardiac imaging in cancer patients. Most recently, she was also the chair of a scientific statement released by AHA about defining cardiovascular endpoints in oncology trials. Welcome, Dr. Barac.
Thank you so much, Ali. True pleasure to be with you.
Same here. Let's head with the first question. So, cardio-oncology has exploded as a field over the last decade. You have been part of building it. What does it feel like to walk into GCOS today versus when you first started?
Well, it is a dream come true. And as a mom of a recent high school graduate, I feel very proud. This is not only my baby, this is a baby of many, but I think it has been just incredible. I could have not imagined where the community is going to take this field. The number of enthusiastic, bright, and inspiring people who have joined the field and who have taken it into so many directions. I think they have expanded the intersection between cardiovascular care and between cardiovascular health and cancer, taken it into reverse cardio-oncology. We've defined so many areas, and I think we will continue to define more. So it is a long way of saying that it's incredibly exciting.
That's great, and it's amazing to witness the how the field evolved over the last decade or so. So moving forward, thinking about the session you will be talking at GCOS. So most cardiologists still treat cardiac reactively. What would it look like if we got prevention right from day one?
I think we're looking. It would look very differently, but I think what we've realized along the way, cardio-oncology is a prime example of precision. And in order to be precise, you have to understand the differences in risk. So understanding what is the pre-existing risk factors and which ones are the most relevant for specific cancer therapy and for the specific cancer, because cancers are often treated as a multimodality type of approach. So how do we define that risk prediction up front is going to be able to, in order to prevent toxicity, we need to be able to understand it first. And we might not have the answer on how to prevent it first, but the moment we understand the risk better, we will be able to predict the risk, watch for it, and engage in that discussion about the prevention. So I think that the field looks exciting for everyone willing to work hard, because it will not, I think one of our first early lessons has been there's no one size fits all. That doesn't work even in general cardiology prevention, let alone in patients who also have had diagnosis of cancer.
Sounds good. Yeah, I'm looking forward to attending your talk in person. So for fellows like me thinking about cardio-oncology as a career, what would you advise them?
So I would tell them there's no better field. If you like these questions, first be honest to yourself. Do you like hard work, and do you enjoy these questions? Those are not easy questions. But I think whomever enjoys, is intrigued by them, is curious about these questions, I think is in for a real treat, because we as a field, we want as many as possible bright and curious and driven and motivated investigators, clinicians, scientists involved in the field, because there's no shortage of questions. So I would encourage everyone, I would tell them to absolutely attend a Global Cardio-Oncology Society meeting. It has evolved into a premier global event. There is a lot of education. If you cannot come connect with the community, and there are many ways to do so, one of the best in person and come together. So a huge encouragement and an invitation to join us in Williamsburg.
Thank you so much, Dr. Barac, for your time today. We appreciate you having you today.
Thank you, and see you in October.
See you, everyone.